So I've been having a lot of pain in my back, and it's been shooting all the way up my spine to the back of my neck.
Okay.
And it's these tingles where it makes it feel like the hair of the back of my neck is just sticking straight up, and it's uncomfortable, and it gets in the way. It's stopping me from sleeping. So I just want to get that checked out.
Have you started any new activities? Do you have any inkling of what might have brought this on?
Honestly, I have no idea.
No new sports?
No.
Have you changed any lotions, any products that you use on your skin?
No.
And when did these symptoms begin?
Maybe about 2 weeks ago.
Can you point one more time where the pain is localized?
Yeah, so the back of my neck here.
Okay. It hurts when I touch you now. Okay. And is it always in the same location?
Yes.
On a scale of 1 to 10, how intense is it?
I'd say a 6.
And how would you describe the pain? Sharp and shooting, or dull in the background?
I say it's sharp and shooting.
And the sensations,
It's this like tingle sensation.
how long do they last for?
I'd say about like 10 minutes
10
at
minutes.
a time.
That's a significant amount of time. And do you feel any pain associated with the sensations themselves, or is it just the neck that hurts?
It's just the neck.
So no pain. Any other symptoms anywhere else in your body that are new?
Yeah, actually, my feet are incredibly cold for some reason. Even when I put on socks, even when I'm on the carpet, like they're just so incredibly cold, and I don't know where it came from.
Do they hurt as well, or just
It's mainly the coldness.
no pain? Good. Are you able to walk when that is happening?
I am, but I prefer not to.
My mom always told me flowers are beautiful because they don't last forever. And I remember thinking, why can't they? Every Mother's Day, I'd save up to buy a bouquet. Never matter what kind. Roses, daisies, wildflowers, whatever I could save up for. She would smile like I'd just given her the world. And then a week later, they would wilt. And then that moment would feel like it was fading too. That's why this year I tried something different. Forever Rose. That's why this year I wanted something different. Something that says, this moment matters and lets it stay. This is the Forever Rose, a real bouquet of roses preserved to last, not just through the week but for years. It's stunning, timeless, and honestly, it feels like the kind of thing my mother would keep right by her bed, just to remember, smile, and become happy. If you're still hunting for the perfect Mother's Day gift, this is it right here. It's not just pretty, it's personal, and it doesn't fade. These roses are specially preserved to maintain their natural beauty for years, without the need for water or sunlight, through a delicate process that replaces the flower's sap with a non-toxic, plant-safe solution. They retain their softness and vibrant color for longer than fresh-cut roses. perfect for lasting memories without the upkeep. Click on the link in the description and get your perfect Mother's Day gift today. This Mother's Day, you will find some incredible deals at roseforever.com. You can find popular floral options such as heart-shaped roses, eternity roses. These preserved roses maintain their stunning beauty for over a year, offering a timeless expression of your love for the moments you want to last forever. Forever Rose. Click in the link in the description and get the perfect Mother's Day gift bouquet from Forever Rose today. And do all of these symptoms start at the same time for you 2 weeks ago?
Yes.
So everything onset all at once. Are you on any new medication since I last saw you?
I'm not.
No. Any new allergies that have developed?
No.
Any blurred vision or double vision when you're experiencing the neck pain?
No.
Any problems hearing, smelling,
no.
Tasting?
No.
Are you able to bend your body? Can you twist left to right?
There is pain when I twist and when I bend over.
Okay.
But I can, it's just, there's pain with it.
Restricted mobility with pain present. Okay, Alessandra, I updated the medical chart with the latest information that you gave me. I'm gonna set this aside and I'm gonna go ahead and start just routine checkup. And then I'll focus on your back and maybe give you a little bit of a massage and relieve some of that pain. I'm gonna put my medical gloves on first. And we'll start with your vitals. Have you noticed any pain when you brush your hair?
No, not that I noticed.
Okay, I'm going to do a visual inspection of the top of your head here, starting with the hairline. Let's take your blood pressure so we have a good baseline. Have you had this done before?
Yes.
Okay. Is it okay if we use this arm?
Yes.
All right, I'm gonna go ahead and match up the artery. And you can just relax your arm, and the legs are not crossed. 130/60. Your systolic is a little elevated. Actually, I'm gonna just set this aside since it's pretty heavy. Have you ever been diagnosed with hypertension?
No.
I do not like that systolic. It's a little higher than I'd want it to be. But we'll monitor it for now and we'll see at the next checkup. If it continues, then I may place you on some medication. Okay. Good. Next up, I'm going to check your levels of oxygenation and your pulse. So go ahead and give me your index finger. And we're gonna set this down. And I'm gonna take your blood pressure, I'm going to take your temperature as well over the forehead. .6, so you do not have a fever. And the oximeter is reading 99.5, oxygenation 75 beats per minute. So your heart is very relaxed. Is it okay if I slide the stethoscope under your shirt?
Yes.
Okay. Go ahead and breathe normally. I'm going to listen to your heart. Normal rhythm. Go ahead and take a deep breath in and exhale out. Good. Checking the lungs now. Deep breath in and out. Good. Deep breath in. Good. I'm hearing a little bit of hissing. Have you been sick recently?
No, I haven't been sick in a little bit.
A little bit.
Like 2 months ago.
Hearing some congestion. Were you diagnosed with the flu or bronchitis or anything else?
Bronchitis.
Bronchitis? Were you on antibiotics for that?
Yes.
And how many days were you on antibiotics?
7.
7 days. I don't think that it cleared out completely. So I'm going to go ahead and prescribe another course. Yeah, it may just be a latent infection that's still ongoing.
Okay.
Right, next up I'm going to feel your pulse in 3 locations over your carotid, brachial, and radial arteries. Okay, all right. So go ahead and just breathe normally. Okay, pulse is normal over your carotid. Brachially looking at the character of the pulse, making sure it's not hyperdynamic. Perfect. And radially over your wrist. Good. I want you to squeeze my hand with yours. Any pain in your back when you do this?
No.
Good. Okay. Can you move the right arm over your left one? Any pain there?
No.
And if you move the left one over the right one, any pain there?
No.
Okay. I'm going to take a sample of the inside of your nose. Is that okay with you?
Yes.
Good. That's one. And then I'm also going to take a swab of the inside of your mouth. Is that okay?
Mm-hmm.
Okay, just go ahead and open. Then the other one. Good. So I'm going to send this to the lab that we have in the building here. And I'm checking for just the regular viruses that we're exposed to around this time of the year. Is it okay if I take a peek inside your mouth?
Yes.
Okay, go ahead and open your mouth and say, oh. Oh, good. I'm not seeing any inflammation. Teeth are normal. Can you stick out your tongue for me? Normal color. Touch the roof of your mouth with your tongue. No masses or inflammation at the bottom of your tongue. Good. All right, Alessandra. Let's go ahead and lay down, and I'm going to inspect your back. Going to take a look at your face and the top of your head. Next, I'm going to start by palpating your face. Checking for any masses or indentations. Checking the lymph nodes. Cervical. Occipital in the back. Preauricular. Not noting any inflammation or enlargement of the lymph nodes. Checking the skin. The eyebrows. and the neck. Both eyebrows are even. Hairline distribution appears normal. Going to press down on your sinuses. Checking for any fluid buildup. Going to percuss on your sinuses. Any pain anywhere?
No.
Okay, good. Go ahead and tilt your head slightly towards the left. I'm going to take a peek inside this ear here. Okay, your canal looks normal, tympanic membrane not irritated. Taking a look at the outside of the ear, auricle, behind the ear. Healthy. Now over on your left side. Any pain when I pull down on the ear?
No.
Any pain when I pull up?
No.
And laterally?
No.
Okay, let's go ahead and take a peek inside here as well. A little bit of wax buildup, but in the normal amount. I'm able to see tympanic membrane, pearly gray color, cone of light is present. Bony landmarks are present. No infection. Discharge is minimal from the wax buildup only. Good. Okay, let's move your head back into the normal position. Take a look at the hairline next. scalp appears normal. I'm taking a couple of random sections and inspecting it, looking for dermatitis, folliculitis, any irritation that may be the underlying cause of any pain. Let's go ahead and take a look at your back next. Ear, face, and top of the head exam cleared out. No positive findings. I'm going to take a look at the back of your head next and your hairline as well as your scalp, and then continue with your spine and your back. Making a note of those observations. Okay. Looking at a couple of other random sections on your scalp here in the back. Checking the color and the distribution of your hair. Not noting any abnormalities as of now. Making sure that I cover an even surface area here. And just ruling out methodically any physical reasons why you may be experiencing the pain. I do see some redness at the top of the spine here, and it does go all the way up towards the scalp. Let's take a closer look. There seem to be a few red patches. Inspecting your spine, checking for any deformity, any deviations or nodules in between the vertebrae. There is a slight curvature towards the right side. Have you ever been diagnosed with scoliosis? Okay. It's not very pronounced, but I am able to detect it. Cervical, spine is straight, going into thoracic and lumbar, though the curvature is palpable. Not able to detect any nodules, so the presence of any masses is not felt. I'm going to percuss your back and check for the resonance. checking your scapula bones. Can you elevate this arm for me? Yes. Good. Now I can lower it. Can you elevate your right arm now? Palpating the scapula. Checking for any loss of bone integrity. Good. Can lower this arm now. I'm gonna go ahead and listen to your lungs. Go ahead and take a deep breath in and out. Okay, continue breathing normally now. Go ahead and slightly cough. One more time. Good. And say 99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
Good. So clear sounds coming from your lungs, no concerns there. I'm going to focus on the top of your spine here and do a skin test first. Check for the level of moisture. I'm seeing a good gradient here. Skin is very well perfused. No excessive dryness. Good. Little bit of dryness, but going towards the bottom here, towards your thoracic and lumbar area. The top is very well perfused. So skin dryness cannot be a cause of concern. Good. 75. 75. So no concern there with the level of moisture. Let's go ahead and do some tests to check the dermatomes in your back. I'm going to give you back the mic for this. So I'm going to touch you either on the left side or the right side of your back. Go ahead and say left or right.
Right. Left. Right. Left. 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 Right. Right. Right.
Good. So this was something very dry and rough. I'm gonna go ahead and use something much softer. So go ahead and tell me if you feel a dull sensation or a sharp one.
Sharp. Dull. 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 Sharp. Sharp. Dull. Sharp. Sharp. Sharp.
I'm just checking for any indentations now. I want to make sure that there's nothing hiding underneath the skin that I'm not detecting. Okay, it all looks clear. I'm not seeing any moles that are abnormally raised. So let's go ahead and lay down, and I'll perform a light massage and try to alleviate some of this pain here. Just checking for the temperature distribution. Normal gradient. Good. I'm going to apply a light mist of water, saline solution to just remove any of the potential debris on your bag. Applying magnesium ointment. Especially around the spine, the cervical area. And working this inside the muscles. Making sure that it really penetrates into the superficial layer of the skin. making a note of your proportions here. Okay, Alessandra, you can stand up now and we can discuss the result. Okay, Alessandra, this completes the exam for today. I investigated your head, your scalp, your back, the top of your spine. I was not able to find anything abnormal.
Okay, good.
Do you have any questions for me or anything else you would want me to focus on today?
No, I don't have any more questions.
Okay, I applied a lot of magnesium on your back and did a light massage. So that should hopefully help alleviate a little bit of the back pain here. And let's see you back in about 6 weeks.
Okay.
Take some ibuprofen, warm baths, try to relax, and let's see how your symptoms progress.
Thank you.
Okay, very nice seeing you today.
Thank you.